Hello everybody. So we were talking about the endocrine system and we stopped here in last lecture. We are talking about the thyroid gland, which is located in front of the lower part of your neck, and this gland looks like a butterfly. So it's a butterfly shaped gland, and it has two lateral lobes connected by isthmus. Okay. Now, inside the thyroid gland, there are many follicles. Follicles are like, structures like this, finger-like structures. So, the thyroid glands are filled with follicles, okay? And uh, in the wall of the follicles, you have the follicular cells. So, these are the follicular cells present in the wall of the follicles, okay? And also in between the follicles you have some cells, like these are the follicles, and in the wall these are the follicular cells, and in between the follicles you have another type of cells. Those are called parafollicular cells. Now if I make a cross section of the follicles and see, it will look like this: many follicles, circles. So each follicle will look like this, right? And in the wall of the follicles, these are the follicular cells. So follicular cells, and in between the follicles you have another type of cells. These are called parafollicular cells. Parafollicular cells. Okay, so those are the two different types of cells. And follicular cells uh, are responsible for the production of T3 and T4, these two hormones, okay? And parafollicular cells are responsible for the production of another hormone of the thyroid gland, that is called the calcitonin, okay? Calcitonin. T3, why it is called T3? Its full name is triiodothyronine. Tri means three, you know that. Iodine, thyronine, also called T3. That means it has three iodine molecules, atoms, three iodine atoms. Okay, three iodine atoms bind with an amino acid that is called tyrosine. Okay, so tyrosine is an amino acid, and three iodine atoms bind with tyrosine to form T3, this hormone. Okay, and T4 is called tetraiodothyronine. Tetra means four, you know that. Tetraiodothyronine. Or more commonly used name is thyroxine. So tetraiodothyronine or T4 or thyroxine, same thing, okay? And this one needs four iodine. That's why called tetra. Four iodine atoms and tyrosine. Same amino acid, tyrosine, okay? Forms T4. T3 and T4 increases metabolism in the body. Okay, increases metabolism. And if T3 and T4 are secreted more, then metabolic activities in your body will be more, right? So that will cause what? You all know when metabolism increases, the heart rate increases, right? Your heart rate will increase. Your blood pressure will increase. Your body temperature will increase, right? Your respiratory rate will increase. You all know when metabolism increases, these changes occur. A simple example is when you do exercise, the metabolism in your body increases and you see the heart rate increases, blood pressure increases, body temperature increases, right? Um, Sweating occurs, respiratory rate increases, and if you do that for a long time, if metabolism is high for a long time, then the body weight will uh, be lost. So you'll lose the body weight, right? So all those decrease body weight. So all those can result from increased T3 and T4, right? And if this is a clinical condition, increased T3 and T4, uh, that is called hyperthyroidism. Hyperthyroidism can cause increased production of or release of T3 and T4. Thyroidism. Hyper means more. Thyroid function will do what? Increase T3 and T4. Right? So that will cause these changes in the body. Okay? If you touch the body, you will feel that the person's body is warm than normal. Body weight is less, skinny, the person heart rate is more, blood pressure is high, respiratory rate is more. So you see, opposite is hypothyroidism. If T3 and T4 production is less, that is called hypothyroidism. Okay. Hyperthyroidism, prolonged hyperthyroidism can cause a disease that is called Graves' disease. Okay. So in Graves' disease, you will see the signs or symptoms of hyperthyroidism. Uh, Prolonged hypothyroidism can lead to a clinical condition that is called myxedema, okay, in which the blood pressure will be low blood pressure, right? Body temperature will be low. The person will be susceptible to cold, so easily will feel cold than normal people. So body temperature is also low. If you touch the skin, the person's body, you will see it's like colder than normal people. Increase body weight. Body weight can increase. So it's opposite of hyperthyroidism. This is due to hypothyroidism. Okay. Uh, Puffiness of the face. Puffy face, like fluid has accumulated in the face, and also vagueness under the eye. So under the eye, you'll see the skin is like swell. That is called bagginess of the uh, eye. So those are two clinical conditions: Graves' disease due to hyperthyroidism, myxedema due to hypothyroidism. Another clinical condition due to hypothyroidism, this is more commonly seen in the young kids, that is called goiter. And goiter occurs if inside these follicles, you remember I said thyroid gland is filled with follicles, so more protein accumulates inside the follicles, that colloid, okay, colloid, that is a protein, stores more, so the follicles will get fatty, right, big, so the whole thyroid gland will enlarge. So this is the enlargement of the thyroid gland, okay, due to accumulation of colloid or protein inside the follicles of the gland, okay. This can occur due to lack of iodine, so that is hypothyroidism. So here you see T4 or thyroxine, uh, and that increases body temperature, uh, increases metabolism, right? Increases respiration, increases heart rate, heart activity, heart rate, and blood pressure. That means heart activity increases heart rate, increases blood pressure, okay, and also stimulates gastrointestinal activity. Uh, so, how the secretion of endocrine regulation occurs? Endocrine hormone secretion is controlled by negative feedback mechanism, okay, feedback mechanism. You must remember in one of my very early lecture, most likely on day one, first lecture, I mentioned about positive and negative feedback mechanisms. So negative feedback mechanisms is like a feedback that inhibits the earlier uh, stations. So here you see I mentioned that hypothalamus is the boss of the pituitary gland, right? So pituitary is the master gland, but hypothalamus is the boss of the master gland. Hypothalamus releases the hypothalamic releasing, those are called the factors, releasing factors. And these releasing factors work on the pituitary gland, okay. And pituitary, anterior pituitary releases 6 hormones. One is thyroid stimulating hormone or TSH. This is just one example how the negative feedback works, okay. So now so hypothalamus releases the uh, releasing factor that would stimulate the pituitary. Anterior pituitary would release thyroid stimulating hormone or TSH, and that will go to the thyroid gland. This is called thyroid stimulating hormone. So it will stimulate the thyroid gland, right? And will do what? Will will cause the release of thyroxine from the thyroid gland, okay, and that will be secreted into the blood, because we know that endocrine hormones are secreted or released into the blood. Now, the blood concentration of thyroxine will go up slowly, and when it will reach to a limit, upper limit, then a negative feedback or inhibition will go to the hypothalamus, okay, and will tell the hypothalamus to stop releasing factor, so stop the release of the releasing factor. So releasing factor will not be released, pituitary will not be stimulated, pituitary will not produce or release thyroid stimulating hormone, thyroid gland will not be stimulated, it will not produce thyroxine, so the blood level of thyroxine will stay below the uh, upper limit. Now, if hypothyroidism occur, in the blood the level of thyroid is less than normal, then that will cause what? Stimulate the hypothalamus to release the releasing factor. In most of the cases, the endocrine hormonal secretion is controlled by negative feedback mechanism. So this is the mechanism in most of the cases, okay. So most of the most of the regulation of secretion is controlled by negative feedback mechanism. So just read that. I talked about myxedema, I talked about Graves' disease. So myxedema, as I told you, is due to hypothyroidism. So what can cause that? One cause is radiation damage to the thyroid gland. So if thyroid gland is damaged, the cells are damaged or destroyed, then the function of the thyroid gland will be less, right? Another could be thyroidectomy, removal of thyroid gland, okay. uh, so if any tumor or due to cancer is surgically remove the thyroid gland, then that will cause hypothyroidism and myxedema, okay. uh, So you can treat that patient by administering thyroxine, the hormone supplement from outside, and that will maintain the hormone level in the blood. Okay. Now another clinical condition that I already mentioned, goiter, enlargement of the thyroid gland, and this occurs due to hyperactivity of the thyroid. In hypothyroidism, usually we see this one. Graves' disease, I already mentioned that hyperthyroidism may lead to Graves' disease, and weight less. You understand that prolonged hyperthyroidism will cause weight loss because the metabolism is always high, so that will use up the fats of the body will be used up because metabolism uh, is high. Another is the pulse, heart rate will be high, I mentioned, right? Abdominal discomfort or diarrhea will occur. Goiter, enlargement of the thyroid gland. Uh, Other symptoms, uh, one is called exop exophthalmos. Exophthalmos is uh, enlargement of the like the you will see the patient's eyeballs are protruded, like coming out. Why that happens? That happens due to accumulation of fat behind the eyeball. So this is your eyeball here, okay, and you know that eyeball is located inside the bony socket, right? So this is the bony socket for the eyeball, and now what happens in exophthalmos, excess fat accumulates behind the eyeball, and that will push the eyeball forward. So it will look like that eyeballs are coming out from the socket. So that is another thing that happens in Graves' disease. Uh, Tremor is another thing, that's fine, shaking of the hand that happens. Polydipsia, the person will feel thirsty. So those are some signs and symptoms, okay. So now tachypnea, heart rate will go up. Insomnia, the person will have sleeplessness. So those are the signs. Here you see a patient with goiter, enlargement of the thyroid gland. Enlargement of the thyroid gland due to accumulation of that colloid protein in the follicles. And this happens usually due to iodine deficiency. Iodine deficiency or lacking of iodine. Okay. So those are related to the thyroid gland clinical conditions. Now adrenal glands, you remember adrenal gland sits on the kidney. So you have two adrenal glands like the crown of the kidney, right? And I mentioned before that outer part of the adrenal gland is called the cortex, adrenal cortex, adrenal cortex, and adrenal cortex has three layers, three clear layers, and three layers produce three different types of hormones. So we say that adrenal cortex is three glands within one. Because three layers work as three different types of glands and release three different types of hormones. And then the inner part is called the medulla. Medulla. Okay. Now cortex produces three types of hormones from the three layers. Let me just mention, this is the adrenal gland, so this part is the cortex part and this is the medulla. So cortex has three layers, right? 1, 2, 3. So 1, 2, and this is third layer 3. And these 3 layers produce 3 types of hormones. Mineralocorticoids, glucocorticoids, and sex hormones. Okay, so 3 layers produce 3 types of hormones. Mineralocorticoids, these hormones regulate the minerals in the body. That's why they are called mineralocorticoids. So regulate the minerals, okay, like sodium, potassium, calcium, those are minerals. The most important mineralocorticoid is, let me write down its name, aldosterone. It works on the kidney and regulates the sodium in the body. So this is the most prominent mineralocorticoid. Works on the kidney and regulates the sodium in the body. Glucocorticoids regulate glucose metabolism, strong anti-inflammatory. So glucocorticoids are what? Strong, causes strong anti-inflammation, heals the inflammation, heals the inflammation, very strong action. And the main hormone of glucocorticoid group is called cortisol. Okay, so cortisol is the main hormone. And in the pharmacy you can buy hydrocortisone. Probably you have seen the ointment or drop you put in your eye when redness of the eye occurs, inflammation, conjunctivitis, or any kind of inflammation in the skin, you put hydrocortisone, right? And this one only if you use 1% or 2% hydrocortisone, that is pretty strong to heal the inflammation. So hydrocortisone is actually a form of cortisol. So you know that it has a strong anti-inflammatory action, and it is a glucocorticoid. And sex hormone is also produced by the innermost layer of the cortex. So this is the hormone, testosterone and estrogen, androgen. Okay. Now medulla, this part, the inner part, produces very important chemical that is called adrenaline. Probably you have heard, and noradrenaline. Their action is very similar. One is called adrenaline, another is called non-adrenaline, also called epinephrine, norepinephrine. Okay, epinephrine and norepinephrine. And adrenaline is responsible for fight or flight response, because both adrenaline and noradrenaline uh, stimulate sympathetic nervous system. Okay, that will do what? Increase the heart rate, increase the blood pressure, increase the respiratory rate, increase the muscle tone. Like, when you are excited or you are scared, those changes occur in the body. So that is the adrenal gland. Cortex produces three types of hormones, and medulla produces adrenaline, noradrenaline. Now, prolonged hypercortical activity, if the cortex of the adrenal gland is hyperactive for a long time, that causes a disease that is called Cushing syndrome. So multiple different types of symptoms occur in Cushing syndrome. The most common things that we see in Cushing syndrome patient: uh, acne in the skin, then we see buffalo hump, okay, buffalo hump, and another is called so buffalo hump is in the back of the shoulder and neck. A lot of fat, a thick pad of fat accumulates. Okay, so the back looks like a hump in the back. Fat accumulates in the back of the shoulder and neck. Um, and another thing that happens, that is called moon face. So the person's face looks like round due to fat accumulation. Okay, so these are three uh, common symptoms of Cushing's syndrome. Okay, and that occurs due to prolonged hyperactivity of the adrenal cortex. And hypofunction of adrenal cortex, opposite, prolonged hypoadrenocortical activity. Uh, Adrenocortical activity will do what? Will cause a clinical condition that is called Addison's disease. Okay, Addison's disease. Uh, so in Addison's disease, we see some uh, symptoms. One is, we say, bronze pigmentation, in the skin, weight loss. Okay, the person will get tired, fatigue, GI tract disorder, pain, and also disorder in the gastrointestinal tract. Okay, uh, and irritability. So those are some signs and symptoms of Addison's disease. So we'll see here, you see Addison's disease, adrenal gland fails to produce corticosteroids. That means cortisol, aldosterone, those hormones. Now, here you see, so I wrote bronze, B-R-O-N-Z-E, bronze, B-R-O-N, right, bronze pigmentation. Anyway, so here you see bronze pigmentation of the skin. Distribution of body here is different than normal person. Gastrointestinal tract disturbances and pain, weakness, fatigue, those I mentioned, weight loss I mentioned, right? Another thing that happens, we see that the blood pressure drops when you change the body position. So when you are stand from sitting position, suddenly the blood pressure drops. That is called postural hypotension. Hypotension means low blood pressure. When you change the body position, like from lying to sitting or sitting to standing, that is also called orthostatic hypotension. Same thing, okay? Orthostatic or postural hypotension. Hypo means less, tension, pressure. Okay, so those are some symptoms of Addison's disease, and that is due to less activity of adrenal cortex due to lack of cortisol and aldosterone, those mineralocorticoids, glucocorticoids, those hormones. I have already mentioned Cushing's syndrome due to hyperfunction of the adrenal cortex, hypoadrenalism, and this is the condition that I mentioned: moon face, buffalo hump, and acne. Those are the common signs. And other clinical conditions: Conn's syndrome, adrenogenital syndrome, and pheochromocytoma. So those are other clinical conditions that occurs due to hyperthyroidism. Here you see a patient of Cushing's syndrome. This is the Cushing's syndrome. So you see moon face. The face is like round due to accumulation of fat, right? And you see a lot of fat in the neck area as well as in the back of the shoulder. So like a bump in the back of the shoulder if you see the back. So those are the signs. Now after treatment, you see this is the patient. So moon face is gone, right? And you don't see those anymore. Acne. So now quickly I'll go over a couple more endocrine glands. Pancreas. Just let's briefly talk about it. Very important. Pancreas. Pancreas is located in the abdomen, and if you see the pancreas, it has like a head part, body, and a tail. If you see the location in the abdomen, this is the duodenum, the first part of a small intestine, duodenum. So the head part nicely, fits in that area, C-shaped, curve of the duodenum. And then body and tail part is attached to the spleen. So that is the pancreas. Now pancreas is a mixed type gland, mixed gland. Why? Because it has both endocrine and exocrine parts. So endocrine as well as exocrine. So it has both types of glands inside. Endocrine part of pancreas, since we are talking about the endocrine gland, releases two very important hormones, and they work just opposite to each other. One is the insulin and another is glucagon. Okay, so insulin, that lowers the blood sugar. You probably all of you know that insulin does what? Lowers the blood sugar, and that's why diabetic patients take the insulin. Blood sugar or blood glucose. Okay, glucagon just does opposite, increases blood sugar. So by the action of these two, your blood sugar is maintained. Both are needed, right? So if you eat heavy meal, your blood sugar will go up right after your meal. So insulin will be released more after your meal. And if you are starving, you're not getting glucose from outside, then glucagon will be released more to increase the blood sugar. Okay, so both are important. And last thing, gonads, testes and ovaries. These are called gonads. Two testes in male body, two ovaries in female body, and they produce sex hormones. Okay, and sex hormones are important. Male sex hormone testosterone, right? This is the male, and female sex hormones are, estrogen and progesterone. And sex hormones do what? Sex hormones help in the growth of reproductive organ, reproductive system, and the function of the reproductive system. So number one, regulate the function and growth of the reproductive system. Number one. Number two, sex hormones regulate uh, secondary sex characteristics. Secondary sex characters. What are the secondary sex characters? The characteristics in male and female body that you can separate a male from a female externally by looking at the external features. So those are given by the sex hormones. You all know that if a girl starts to get male sex hormone testosterone, then changes start to occur in the body, right? The appearance becomes like more male appearance. So we know that sex hormones give the external appearances of a male and a female. Now, in case of male, what are the secondary sex characteristics given by the testosterone? Muscles more prominent, right? Skeletal muscles, prominence of muscles, Adam's apple, right? Laryngeal prominence or Adam's apple is present in male. Um, Broader shoulder, okay. Then baldness, that we often see baldness in male. And another important one is what? Facial hair, right? Facial hair and voice, loud, low pitch but loud voice. So these are male secondary sex characteristics given by testosterone. So if a girl takes the testosterone for a long time, you will see these changes start to appear. Female secondary sex characteristics include subcutaneous fat, that is called fat, subcutaneous, under the skin. Okay, high pitch voice, high pitch voice, right? Broader hip or wider hip, right? Mammary gland or female breast. So all those are the features that separate a male from a female. Those are called secondary sex characteristics. So those are also given by sex hormones. So growth and functions of the reproductive system. Number 2, secondary sex characteristics. Number 3, sexual behavior. Behavior and desire. Okay. Uh, those are controlled by the sex hormones, and sex hormones come from the gonads, testes in male, ovaries in female. Okay, so just know those things from the endocrine glands, endocrine system, and you are good to go. Thank you.